Now, this is a type of scan that is sometimes offered if the sonographer hasn't been able to see everything they need to see during a normal abdominal ultrasound scan. They should always explain to you why they're offering you this as an alternative scan. Now, what will happen is they will give you time in private to take off your underwear and to make yourself comfortable. They'll ask you to come onto the couch where the sonographer will perform the scan. They'll ask you to bring your feet up to your bottom, and they'll ask you to let your knees fall to the side as they do that. It's important that you stay as relaxed as possible to make this as comfortable as possible. They use a probe, which is kind of just like that sort of shape like that, and they will cover that end with a condom and some gel to make it as easy as possible. Now, you might find a little bit of a wet sensation as they start to use that, and it's a little bit cold as well. They don't insert the probe a long way, so don't panic. It just tends to be just into the opening of the vagina. Now, it can feel a little bit uncomfortable whilst they're sort of looking for what they need to look at and dependent where they need to aim that probe at. So they'll move it a little bit sort of up, down, side to side. But as I said, it's not like it's inserted far in, so please don't worry about that in any way. Now, when they're doing this exam, sometimes you can feel a little bit exposed with any kind of vaginal exams. They should cover you with a sheet or some paper. And some people, if they think this might be the kind of scan they have, they choose to wear a skirt because sometimes that makes you feel less exposed. You should also have the option of bringing a friend or a partner, or just ask for another member of staff so you have a chaperone during the examination. And they'll usually ask that before they perform this exam that your bladder's emptied. So if you've come for a normal scan and then they're going to swap to vaginal scan, they'll ask you to pop to the toilet and empty your bladder first. This, like any procedure, you can ask for it to stop at any time if you're not happy with it or you feel uncomfortable. After the examination, the sonographer will usually leave you with some paper to give yourself a wipe down and give you time to dress. Now, it's up to you and the sonographer as to whether you ask the sonographer to talk about what they're seeing during the exam or whether you want to know about it after you've been dressed again.